After holding an extraordinary meeting to discuss how best to manage the surge in infections of COVID-19 across the counties, the governors emerged to spell out resolutions from the meeting. Among their list of priorities was the welfare of healthcare workers, concerns over the delayed disbursement of county funds, and the slowing down of county services owing to lack of salaries for county staff.
It is now 3 months since counties received equitable funds from the National Treasury. This has hindered effective general operations of the counties, including targeted responses to COVID-19 escalating cases.
The Council of Governors Chair, Wycliffe Oparanya, urged both levels of government to urgently intervene and resolve the persistent crisis.
If the prevailing situation escalates into the 4th month without resources, then we may be staring at a looming shutdown of all services in the counties. This is a never-ending problem that begs for both levels of government to find a lasting solution.
On COVID-19 management, they announced plans to launch a massive sensitization campaign and escalate the enforcement of health safety protocols.
All county governments will embark on a rigorous civic education campaign dubbed No Mask, No Service, Bila Parakoa Hakuna Huduma, beginning Monday, the 23rd November 2020.
The governors also revealing that efforts have been put in place to equip health facilities across the counties, including sourcing for adequate oxygen tanks to assist COVID-19 patients in critical condition.
In order to increase the current supply of oxygen in isolation facilities, county governments will increase the capacity of oxygen reservoir tanks to allow extension of oxygen supply to at least 50 beds in each isolation facility.
On the welfare of healthcare workers, the governors say they will ensure frontline soldiers in the battle against COVID-19 have adequate personal protective gear and comprehensive medical cover in the event they contract the virus.
We shall be having a meeting on Monday, 23rd November, with the CS in charge of health, including the National Treasury, to conclusively discuss issues relating to insurance for health workers and their allowances.
Their sentiments coming even as the healthcare workers have threatened to take industrial action, lamenting over poor working conditions with lack of adequate PPEs, hence putting them at risk of contracting the virus. For Channel 1 News, I'm Serfine Achieng Ouma.